So this is your syllabus of NDDS, that is Novel Drug Delivery Systems. So in Unit 1, you are going to learn about the controlled drug delivery system, basically controlled release. To make some formulation or make some substance in controlled, that is a release, you need some polymer. Okay, you need some polymer. So by using polymer, you are making a formulation where you can control their release, their rate of that is a release, their duration of action, everything you can control. So you need polymer. So that's why we shall learn separately about the polymer. Then in Unit 2, I will tell you about micro encapsulation. All of you are aware what is capsule. So in this place, in this topic, we are going to learn about the micro encapsulation. In micro form, we are going to do something. Then mucosal drug delivery system, we shall also see how bioaddition and unique addition and other things are actually being done. Very important, implantable. I think many of you might have seen that there are lots of implant, है ना, हमारी बॉडी में जो है बहुत सारी that means ऐसे diseases के लिए there are some implant we are actually putting, especially in dentistry, है ना, implant. So there is a new approach where we are actually doing implantable drug delivery. You have some drug molecule and you can change and you can change in such a way so that some implantation will be there. Just let me make some change so that nobody can remove you during the lecture. Yeah. Then in Unit 3 we shall learn about in transdermal. Now what is transdermal? Transdermal means like cream. All of you are applying some cream and other kinds of lotions, etc., etc. So right now, if you want to apply some substance, you want to apply some drug locally. तुम्हारे हाथ में या फिर in your skin, some locally some diseases are actually there. You want to solve this disease. For that you need transdermal drug delivery. Gastroretentive means GIT. It will be associated with your GIT. So in your GIT you have stomach, intestine and other things. So some drugs will be floating, some drugs will be go there and it will float, it will be released slowly and slowly. So all those things, if you apply or if you put some drug in GIT, we shall see here. Then Naso pulmonary drug delivery system. Naso pulmonary means pulmonary. Pulmonary क्या है? Pulmonary is simple our lung and our respiratory associated areas. Naso means our nose. So we are going to give some drug molecule through nasal route, which will be uptake by our pulmonary system. That means lung. नाक से तुम कुछ दे रहे हो. Some drugs you are actually giving through nose. Now in Unit 5 we shall learn about targeted drug delivery. Now what is targeted? You have some drug and you are trying to solve some disease. So to solve the disease you are trying to that is send your drug to the targeted area, site of action. So that's why targeted drug delivery concept is actually coming. Liposomes, muosomes, nanoparticle, monoclonal antibodies and other things actually going to learn here. In Unit 5, the last unit, in this unit we shall learn about the ocular drug delivery. Ocular माने क्या है? Eyes. Okay, some drug you're going to apply on your eyes, how they are going to work, how they are going to solve some conjunctivitis or other related disease. We shall see there. Then intra-unit drug delivery system. So there are lots of devices and other things like IUD. So we shall see that how IUD devices are actually being put to solve the diseases in your intra-unit. So these things, these 5 units we are going to see. Unit 1, control release we shall see. Then to make some control release or control drug delivery system, you need polymer. We shall see how polymers are actually classified, their properties, advantages, disadvantages, everything. Unit 2, micro encapsulation. Unit 3, mucosal drug delivery. Then implantable. मैं lecture ले रहा हूँ. And in Unit 3 we shall see transdermal, gastroretentive, nasopulmonary. Okay. And Unit 4, targeted drug delivery. And Unit 5, ocular and intra that is a urinary drug delivery system. So very simple. The topic is very simple, and I don't think it will take so much time to complete your entire syllabus. And lots of things you're going to learn here. So, if do you want to ask anything or anything you want to share regarding your syllabus and upcoming journey? Or is it very tough, or what is your understanding after discussing just basic things? बहुत सारे शब्द तुम लोगों के लिए शायद नए रहे होंगे, जैसे फॉर एग्जांपल लाइक दिस थिंग्स, लिपोसोम्स, न्यूसोम्स, नैनो पार्टिकल, मोनोक्लोनल एंटीबॉडीज, इसमें से बहुत सारे टॉपिक्स तुम लोगों के लिए तुम लोगों ने शायद पहली बार सुने होंगे, फॉर द फर्स्ट टाइम यू माइट हैव दैट्स लिसन. So don't worry, these things will be very easy. I will try to make everything in a very simpler form. Now the question is, why we are actually trying to give the drug in such a manner? Why we are trying to bring NDDS? So to tell you, I have a very interesting. Let me share this picture. Yeah, can you see this picture?
Yes, sir.
Yes, sir.
Okay, so the picture what you are actually observing right now. So this is a picture of our blood vessel. Okay, so when you consume one drug molecule, a tablet, capsule, syrup, or whatever, when you consume one drug molecule, ultimately the drug should reach at the site of action. The drug should reach at the site of action so that it can show its pharmacodynamic activities. Now, what is pharmacodynamic activity? Pharmacodynamic means simple. It will show its therapeutic effect. Dynamics, it will show its effect. It might be that is doing up regulation, down regulation, blocking, inhibiting, or anything. कुछ भी हो सकता है, anything possible. So this is a part of pharmacology. That is dynamics, how drug is working. This is a part of pharmacology. In our that is a subject, or in our understanding, what we actually do, our main area is to make the drug in such a manner so that it may reach at the site of action. Okay, so as soon as it will reach at the site of action, then it will be able to show its therapeutic effect. Now to reach at the site of action, it has to pass with a lots of barriers. ठीक है, ड्रग जो है एक्शन पहुंचने के लिए इसको बहुत सारे बैरियर्स को क्रॉस करके जाना होगा. So for example, you can see this is a blood vessel, like this is an artery. Now your drug molecule, for example, this is your drug molecule. Your drug molecule size is very big. Your drug molecule size is very big. So what will happen? If the size is very big, then it will be not able to show good penetration. It will be not able to show good penetration. For example, देखो यहाँ पे तुम देख रहे हो, this is what is this? This red thing is RBC. This red thing is RBC, and I am telling you this big ball is your drug particle. So how it will be cross this barrier? ये जो यहाँ पे देखो ना, you can see this diameter of this area and this area. This is much more smaller. So this big ball or this drug molecule will be not able to pass this area. That's why to make our drug formulation much more better or much more efficient, we are actually introducing NDDS. Now what is the full form of NDDS? Novel Drug Delivery System. Novel Drug Delivery System. माने in simple, we are making our drug molecule in such a manner so that it can cross all these barriers and it can reach at the site of action. So now to make it so much comfortable, to make it so much qualified, so that it can cross all the barriers, it can pass all these small areas and it may penetrate properly and reach at the site of action, what are the things we can do? कैसे हम कर सकते हैं? No, it's a challenge. Our drug particles are big. So if we have a big drug particle, it will not able to cross all these barriers, small barriers. So हम कैसे कर सकते हैं? हम कैसे इसका जो है penetrability और its efficacy हम increase करेंगे? The answer is controlled release. Here I have written. We can do controlled release, or we can add some penetration that is enhanced penetration. enhance penetration. ये जो penetration है यहाँ पे जब जाएगा ना this area, when it will go in this area, it may increase its penetration level or increase uptake. Your that is a body compartment or body substance, it may increase its uptake or extend circulation. It may circulate over the time, over the that is all the different areas, and overcome the MDR, multiple drug resistance. So these are the various way our NDDS is actually working. Do you have any question or anything you want to ask till now, or I am that is able to teach you correctly, or are you understanding, students? Today is the first lecture. I just want to make everything is very simple so that you can understand everything.
Yes, sir.
Okay, Alina, what about others? नदीम समझ में आ रहे हैं? प्रेरणा, संगम, मुस्कान, मानसी,
Yes,
पिंकी.
sir.
ओके
Yes, sir.
Yes. Yes,
ओके
sir.
ओके.
Yes, sir.
अच्छा, तो मुझे एक चीज बताओ, तो तुम लोग समझ के कह रहे हो. लेट मी टेक टू यू टू माय नोटपैड. लेट मी टेक टू माय नोटपैड. Yeah. So let me write few things and then we shall continue our discussion. So for example, you have tablet. T-A-B-L-E-T. You have tablet. You have capsule. You have syrup. है ना? R-U-P. You have tablet. You have capsule. You have syrup. So what is the problem with this thing? Tablet, capsule, syrup ये सारे जो है ना, इनमें क्या problem है? कि so that we are talking about NDDS. हमारे पास टैबलेट पहले से ही, वी हैव टैबलेट सिंस लास्ट मोर देन 100 years. कैप्सूल भी हमारे पास है, सिरप भी हमारे पास है. सो इफ यू डिस्कवर अ ड्रग मोलिक्यूल, फॉर एग्जांपल COVID-19, you have discovered a new drug molecule for COVID-19. It is very easy to make some tablet of that drug molecule, and you may give patient to this tablet, and after that he will consume the tablet or he will fine, or you can make some capsule, or you may make some syrup. है ना? This will be very simple. So why we are talking about NDDS? So can you tell me any of the disadvantages of tablet? Tablet की कोई disadvantage मुझे बता सकते हो तुम लोग कि सर tablet में ये disadvantage है, या कैप्सूल में, सिरप में?
तो फर्स्ट पास मेटाबॉलिज्म हो जाता है.
पिंकी एक मिनट है, मैं हेडफोन लगा लेता हूँ. I cannot hear your voice. Just a second. Let me put my headphone on. Just a second. Yeah, hi. Can you hear me? My voice is clear, Pinky?
Yes, sir.
हाँ, बताओ क्या क्या प्रॉब्लम है, या फिर व्हाट आर द डिसएडवांटेज ऑफ टैबलेट?
सर फर्स्ट पास मेटाबॉलिज्म हो सकता है जिसकी वजह से बायो अवेलेबिलिटी जो होती है वो डिक्रीज हो जाती है. लेकिन जो NDDS सिस्टम होता है इसके थ्रू हम जो है वो जो एग्जैक्ट लोकेशन होती है वहाँ पे डिलीवर कर सकते हैं ड्रग, और उसकी बायो अवेलेबिलिटी भी बढ़ा सकते हैं इसके थ्रू. तो ये भी एक एडवांटेज होता है.
Good. According to you, in NDDS we can increase the bioavailability. ठीक है, fine, very good thinking. Any other points?
Not suitable for unconscious patient.
कौन सा टैबलेट, कैप्सूल, सिरप?
Tablet.
ओके. फिर से बताओ.
Unconscious. Not suitable for unconscious patient.
ओके, नॉट सुटेबल फॉर. एक्चुअली काफ़ी दिन बाद जो है मैं राइटिंग कर रहा हूँ. अनकॉन्शियस पेशेंट. ठीक है, वेरी गुड वेरी गुड. और बताओ. सी मेरी क्लास में है ना, यू शुड ऑलवेज ट्राई टू थिंक, चिंता करो, सोचो, क्योंकि जो है धीरूभाई अंबानी कहा करते थे कि तुम कोई भी नया इनिशिएटिव लो, तुम कुछ भी नया काम करो, 100 लोग आएंगे तुम्हें रोकने के लिए, बट व्हेन यू थिंक नोबडी कैन स्टॉप यू। व्हेन यू थिंक न्यू आइडियाज विल कम इन योर माइंड। न्यू आइडिया माने न्यू टेक्नोलॉजी, तो फ्यूचर में उस टेक्नोलॉजी को बनाओ, फिर वो टेक्नोलॉजी तुम्हारा यू विल बी हैव पेटेंट फॉर 20 years एंड यू कैन अर्न मनी। सो इसलिए हमेशा आई एम टीचिंग और एनी टीचर इज टीचिंग, ऑलवेज यू थिंक, बस सोचो। तुम्हारे कॉन्सेप्ट सही हो सकते हैं, गलत भी हो सकते हैं, बट डोंट स्टॉप थिंकिंग। ओके, प्रेरणा's point is absolutely correct. What about others, capsule, then your syrup, इनकी कुछ डिसएडवांटेज बताओ मुझे, what according to you? Alina, you want to share something?
Yes, sir. So for capsules, hygroscopic drugs cannot be used for capsules.
Hygro या hydro?
Hygroscopic, sir.
ठीक है, ठीक है, hygroscopic, yes, you, ठीक है, we cannot use, okay, or Nadeem is very silent today, Nadeem, and also Ravi. Ravi is a very good student. Ravi, why you are silent? Mukul भी कल आया था कॉलेज. Mukul, you have to share any disadvantage of these systems, tablet, capsule, syrup? और कौन-कौन है क्लास में? बिक्सित, तानिया, शिखा, प्रेरणा. ओके, प्रेरणा तो बोल रही है. ओके, चलो देखो, whatever we are actually talking, the tablet, capsule, syrup, yes, तुम लोग ने जो बताया है that first पर मेटाबॉलिज्म में प्रॉब्लम है, so that बायोअवेलेबिलिटी यहाँ पे कम हो जाती है. So these are few of the disadvantages. That's why we cannot go with tablet for every drug molecule. Capsules, yes, Alena was absolutely correct. Those drugs are hygroscopic. We cannot keep them. Other side, one of the big problem is that duration of action. Duration of action, we cannot control this. Serum, also whatever the things we are trying to put here, similar problems are also here, like duration of action, controlled release. Controlled release, we cannot control. Okay, so and most important thing, that is number of doses. Number of doses. देखो, जितने हमारे पास conventional system है, tablet, capsule, syrup, ये सारे, somebody, some patient is actually suffering from a disease, and you need to maintain the, for example, this is the time, and this is the concentration of drug. So this is the therapeutic that is a regime. Your drug should be, this is the Cmax. Okay, so your drug should be, the passing of time should be like this, ऐसे होना चाहिए, है ना? But the problem is what? Problem क्या है? For example, tablet, capsule, syrup. You have taken the drug molecule. Let me take another color. You have taken the drug molecule. It has reached, and suddenly इसका जो मिनिमम कंसंट्रेशन है ये कम हो जाती है. सो एट दैट टाइम डॉक्टर्स विल टेल दैट यू मे टेक अनदर डोज. ओके, यू टू टेक अनदर डोज, यू टू टेक अनदर डोज. सो इफ दिस इज 24 hour, if it is 24 hour and your drug is actually completely get eliminated within 3 hours. For example, this is 3, I'm writing here 3. Here it is 6, 3 is 6, here it is 9, here it is 12, 15, then 18. So you can imagine you have to take huge number of doses. ये जो सारे पिक दिखा रहा हूँ, एक डोज है. So is it possible? Those are oldest people. You cannot give them lots of dose. These are all dose. DOS. It is not possible. You have some disease, and in every 3 hours you have to take one dose. Do you think this is a good way to give drug delivery? Of course no. Because if you have to take continuously doses, what will happen? Those oldest people, they will forget. उनको याद ही नहीं रहेगा. यार मैं भूल गया दवाई लेना। फिर जो है what will happen if somebody forget to take his dose, so therapeutic activity यहाँ पे जो है in this area there will be no any drug molecule and then it will be a problem, है ना? That's why we are trying to introduce a new system. We are trying to introduce a new system so that we will take one dose and it will be released continuously, constantly with a controlled release, and we can get longer duration of action. We can get long duration of action. In this case, we have short duration of action. ठीक है, short 3 घंटा 3 घंटा. But in NDDS, we can get long duration of action, 12 hours. अच्छा, how many of you have seen the movie called Uri the Surgical Strike? देखिए हो कोई भी? Or any of the movies related to army operation? Okay, Pinky देखिए. और yeah, Alina was also trying to say, I think. Okay, देखो जितने भी आर्मी और सोल्जर्स के ऑपरेशन होते हैं ना, वो लोग लंबे वक्त के लिए जाते हैं इन देयर दैट मींस ऑपरेशन, इन देयर बैटल फॉर लॉन्ग टाइम. ठीक है, सो डू यू थिंक वो लोग खाना जो है चावल 20 किलो 40 किलो आटा ये सब साथ में ले जाते होंगे? इट्स नॉट पॉसिबल, है ना? सम सोल्जर, सम टीम सोल्जर दे वेंट फॉर ए मिशन फॉर एग्जांपल 14 days. 14 days, तब एक तो उनको भूख तो लगेंगे ना, they will be hungry, then they need energy, and they also need some basic nutrients like carbohydrate, protein, vitamin, fat, etc, etc. So they need food, hungry, food चाहिए, energy चाहिए, and they need basic nutrients. So it is not possible to take all these belongings when they will be go for a mission, or a mission in a jungle or in a border or in such area where the enemy may see them, they will automatically get killed. Possible nahi. So at that time, how they will go to that mission, that is with full equipment, and so that इनको भूख भी ना लगे, इनको भूख भी नहीं लगेंगे, इनको प्रॉपर एनर्जी मिलेंगी, और जो उनकी बेसिक न्यूट्रिएंट्स है टू मेंटेन द बॉडी फिजियोलॉजी, इट विल आल्सो फाइन. कैसे करेंगे वो चीज़? Coming here, NDDS. Okay, बहुत साल पहले when I was a child, so at that time मेरे जो दादाजी बुजुर्ग वगैरह थे घर में, उनको मैं देखता था हर 4 घंटे में, in every 4 hours they used to take some medicine for their disease whatever. But right now when I see the oldest people, I don't see that they take drug molecule or drugs in every 4 hours. They take drug molecule once in a day or twice in a day. How it is possible? Because of the advancement of these things, novel drug delivery system. So what we are doing here in novel drug delivery system में क्या करते हैं? What we are actually doing in novel drug delivery system? We are actually try to make such a drug molecule, which drug molecule, let me take this, may show this. If this is the highest concentration of a nutrient, of a drug or anything, this is the lowest concentration, and this is the time. For example, I am writing here 18 hours. Okay, so when they will consume the drug molecule, it will remain in their system circulation for long period of time, so that body can get the nutrient, drug or whatever the thing for a long duration. Similarly, I was giving you the example of army. Let me take another color. I'm giving you the example of army soldier. So in this case, they need food. So what they will do, glucose or whatever the substance they have, they will make some controlled release system. They will consume it one, and from that compartment, their glucose and other substances, it will release in this manner, so that bhuk unko na lage. Energy same. They will take, for example, another that is a substance. They will take another substance. It will be here. Or for example, for body nutrients, they will take another substance. I am taking another. Yeah, it will be released like this. It will be not like this. ये ऐसा नहीं होगा, ठीक है? ऐसा होगा तो it will be problem. If just a second, let me take the proper ink. Yeah, if it will show like this, तब क्या होगा, इनको जल्दी से भूख लग जाएगी, 3 से 4 घंटे में ही जो है भूख लग जाएगी. As a young student, if you want to make some substance so that तुम लोगों को भूख ना लगे लंबे समय तक जो है, if you want to, देखो there are lots of process. मैं तो बस simple एक example दे रहा हूँ. There are lots of process by which you can make it. Okay. As a student of pharmacy, if you have to make some molecule or something in such a manner so that you can get long duration of action, then it will be coming under NDDS. I think I was mentioning about the bioavailability, है ना? So okay, so what is bioavailability? Except Alena Adar will tell. अच्छा, ये समझ में है पूरा जो बताया मैंने? Is it clear to you, students? Pinky, Alena, Mukul.
Yes, sir.
Okay. अच्छा, how many of you are listening this lecture? Seriously, just raise your hands. Because online में यही एक प्रॉब्लम है, स्टूडेंट्स जो है मोबाइल को ऑन करके कहीं पे चले जाते हैं. Alena, Mukul is listening. Those of you are listening this lecture, please raise your hands. Okay, Ravi, Pooja.
Present, Nadeem.
अच्छा, नदीम, ठीक है नदीम.
Yes, sir.
Okay. नदीम, कल तो तुम लोग आ रहे हो कॉलेज? कल ऑफलाइन है?
Yes,
Okay.
कल आएंगे.
ठीक है, fine. Okay, maximum of you are listening, but some people like Shikha, then Ravi, Muskan, Pace, David. Okay, okay, Sangam is here. Okay, okay. Anyway, अच्छा, समझ में आया नदीम तुम लोगों को? Whatever I am trying to show you here.
Yes, sir.
Okay, देखो. So that's why this subject NDDS is becomes much important. देखो, now another thing I'll share with you, the bioavailability. So what is bioavailability? Who will tell me in your language?
So the fraction of drug absorbed in the systemic circulation. कितना ड्रग जो है वो हमारा सिस्टमिक सर्कुलेशन में जा रहा है, सो वही हमारी बायो अवेलेबिलिटी होती है.
ठीक है, और थोड़ा और भी कुछ बताना चाहोगे? Is it related with time? टाइम के साथ उससे कुछ है? देखो, बहुत सिंपल. You have a drug molecule. Okay, मेरा handwriting बहुत खराब है, इसके लिए I am sorry. You have drug molecule. So you have taken the drug. Where it will go? In your GIT. What is this? This is your stomach. From stomach it will come here. यहाँ पे बहुत सारे तुम्हारी intestine ये सारा कुछ है ना? फिर after that it will go through your large intestine and then it will come out from your body. मेरा handwriting खराब है, इसलिए I am sorry and I was not getting it. So you know this stomach. Let me also zoom here. Yeah. In this area, you have drug molecule. You have taken orally. यहाँ पे मैं बना देता हूँ तुम्हारा. You have taken orally. So when it has reached here in this area, यहाँ का environment कैसे? Is it acidic or basic, students? Stomach का environment
Acidic.
Stomach is acidic. So obviously, the drug molecule, if it come here, if it is acidic, there will be happen disintegration. DIS. Disintegration. And your tablet will be broken into pieces. Disintegration. And when it will come here in your intestine area, there will be it will actually mix. In this area also it will mix with the liquid. Here after dissolution, here at this place absorption will happen. Absorption will be happen. So for absorption, two things are important. One is the solubility. Another is the permeability. Solubility and permeability. If it is properly get soluble in your GIT fluid, then that fluid is actually intestine में क्या होता है? In our intestine, actually the liquid is actually being get absorbed. The liquid is actually get absorbed. So if you take up some substance, when it will be show proper dissolution, then it will be absorbed through your intestine. In your intestine you have microvilli and other things. So that's why let me change the color. Yeah. So that's why for absorption you need good solubility and permeability. So after absorption, what next? After absorption, whatever the percentage will remain in your systemic circulation, what are the fraction of this drug? You have taken this drug, it reached here, where it has broken into pieces. Some part will be actually removed. Some part will be removed, it will be not able to get absorbed. So if you take 100% or 100 amount of the drug, and if 70% of the drug is actually remain in your the blood vessels, so you may call the bioavailability is 70%. Okay, if you have a drug molecule, you have taken the drug molecule through orally, it has come here in your this GIT. Here the environment is acidic, not basic. Due to acidic environment, disintegration is actually happened. Disintegration. After disintegration, it will become like the pieces, some small pieces. If it is very good water soluble, then whatever the GI, whatever the gastrointestinal fluid is here, so that thing will be get dissolved in that fluid. Okay, that's why solubility is important. And after dissolving, when it will come to your intestine, small intestine, large intestine, there will be some permeation. If it is size is very small, it will be able to get absorbed properly. After absorption, when your intestine is able to absorb that thing, that drug, after absorption, the drug will go to your this thing called blood vessel. In your blood vessel, the drug will remain. So what amount of drug will be present, the concentration or fraction, that number we call it as a bioavailability. In very good books, you will be getting the rate and extent. Okay, the rate and extent. You will be getting a lots of definition. This is up to you what definition you will follow. Now, I think Alina was mentioning, sir, Alina was mentioning that, sir, if we take these things like tablet, capsule or syrup, so the problem is the bioavailability. We are not sure that whether we will be getting very high bioavailability or not. Maximum case we will be getting low bioavailability. But in NDDS, we can increase the bioavailability. She is absolutely correct. Now, how we can increase the bioavailability of a drug? Yeah. You have taken one drug molecule. In this case, you are getting 70%. In many of the case, like drugs like tadalafil, Tadalafil, drug like tadalafil, you will be getting bioavailability only 30%. Okay, so it's a problem. 30% bioavailability is very low. So, like drug like tadalafil, if you take tadalafil orally 100%, after going proper absorption, it will give bioavailability only 30%. So 30% drug molecule will be remain in your systemic circulation. So it will be not able to show proper therapeutic action. Its concentration will be like this. Okay, it will not able to reach to the minimum inhibitor concentration. That concentration has to be improved. That's why we have NDDS to enhance the bioavailability. Okay, is it clear, students? Just answer and tell me.
Yes, sir.
Okay.
Yes, sir.
Now, do you think the tablet, capsule, syrup are too poor, or ये जो सारे चीज़ है ये सारे इतना ही खराब है, so that we can replace the entire tablet, capsule, syrup with NDDS? Do you think it is to be feasible or it will be correct? Tablet, capsule, syrup सारा बंद. We shall not use those things. We shall only focus on NDDS. Do you think is it scientific or logical?
नो सर, फिर बहुत एक्सपेंसिव भी तो हो जाएगा.
Absolutely, absolutely. It is absolutely correct. So, I have told you the disadvantage of tablets. Now I am telling you the disadvantages of the NDDS. So, I'll go on with this. Yeah, Pinky. So the problem is first is the expensive. EXPENSIV. Expensive. It will not. So it is a cheaper, so that everybody can afford that thing, and it will be easier. Any other points? NDDS? Nothing? You want to share anything? Alina, Mukul? About the expensive. ठीक है, जब हम NDDS में किसी ड्रग को हम बनाएंगे, it will be obviously it will become so expensive. So do you think any other disadvantage? I have told you the good part of NDDS कि हाँ हम उनका bioavailability बढ़ा सकते हैं, then we can maintain this regime, we can get longer duration of action, the concentration everything will be under control. Okay, so these are the good thing. But what are the just a poorest side or bad thing or disadvantage? One point was the expensive. Another thing, skills. Skills. You need very good skills to make some NDDS based formulation. You need very good skills to make NDDS based formulation. Then equipment. Your EQUIPMENT. Equipments. You need good equipments so that you can make such formulations. Okay. So that's why you should always remember everything has some advantages and everything has some disadvantages. दुनिया में जो भी चीज़ है, सभी चीज़ का कुछ ना कुछ advantages है और उससे कुछ ना कुछ disadvantages भी रहेंगे. So that's it from my side for today. I think मेरा एक और lecture है आज. So remaining thing I will tell you in my next lecture. Meanwhile, let me download attendance, and if you have any question or anything you want to ask, welcome. समझ में आया तुम लोगों को आज जो डिस्कस किया?
Yes, sir.
Yes, sir.
Okay, great. So great. Let me also stop the recording.